Hello everyone, this is Dr. Ashley Etchison from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. This month, we have curated some interesting literature on breast imaging. In this retrospective study, researchers sought to establish the utility of breast MRI in identifying asymptomatic disease recurrence in patients who previously underwent therapeutic unilateral mastectomy. Of the 402 breast MRIs reviewed, 395 patients had benign findings on the mastectomy side. 7 of these patients had breast MRIs with suspicious findings for malignancy and given a BI-RADS 4. 4 of the 7 patients had biopsy-proven malignancy. The sensitivity and specificity for MRI detection of malignancy on the mastectomy side were 66.7% and 99.2% respectively. The cancer detection rate for this subset of patients was 10 cancers per 1,000 examinations. The authors concluded that the asymptomatic mastectomy side should be included in MRIs of the contralateral breast to evaluate for cancer recurrence after mastectomy. In this retrospective study, researchers sought to determine the outcomes of 6, 12, and 24-month follow-up for BI-RADS 3 lesions, which have an expected malignancy rate of less than 2%. Cases were selected from the National Mammography database and included patients over 25 years old without a personal history of breast cancer. Approximately 45,000 cases were selected. Biopsy-proven cancer yield rates at 6, 12, and 24-month follow-ups were 1.5, 1.2, and 1.86% respectively. Researchers concluded that in the National Mammography database, the use of BI-RADS 3 category is appropriate, as the cumulative cancer yield rate over 2 years was 1.86%. Researchers also noted that 57.8% of malignancies were diagnosed before or at 6 months, reinforcing the need for short-term follow-up for BI-RADS 3 lesions. In this study, researchers sought to predict axillary lymph node metastasis in breast cancer patients with the use of a radiomics nomogram, including integrated features from preoperative digital mammography and clinical risk factors. A total of 216 patients with pathology-proven breast cancer were divided into primary and validation cohorts. Radiomic features were obtained from craniocaudal views of mammograms. 95 out of 216 patients had pathology-proven axillary lymph node metastasis. The radiomics nomogram, which included features like progesterone receptor status and molecular subtype, had area under the receiver operator curve values of 0.883 and 0.863 for the 2 study cohorts. The authors concluded that their mammography-based radiomics nomogram is a non-invasive assessment for the prediction of axillary lymph node metastasis, which may aid clinicians and patients in preoperative planning. In this retrospective study, the authors sought to determine the predictive value of preoperative mammographic microcalcifications representing residual tumor after neoadjuvant chemotherapy. Patients who had microcalcifications on mammography after completing neoadjuvant chemotherapy underwent breast MRI and immunohistochemical analysis. 96 patients were included in the study. 10 patients had pathological complete response and residual mammographic microcalcifications were benign. Of the remaining patients, 28.1% of residual microcalcifications were benign, and 61.5% represented in situ or invasive carcinoma. Compared to residual mammographic microcalcifications, MRI was better at predicting residual tumor in all breast cancer subtypes. The authors concluded that in approximately 1/3 of the study cohort, mammographic microcalcifications did not correlate with residual tumor. However, MRI and molecular subtype were useful predictors of residual tumor after neoadjuvant chemotherapy, regardless of residual mammographic microcalcification extent. For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions with us on the Breast Imaging Forum, and we'll see you next month.